So much of the beginning of us talking about this pandemic was all about flattening the curve, right? This idea that we wanted to keep that peak lower to preserve the capacity of our health systems, but that also does and likely will mean that we have a lower but longer curve. And so some of you have seen the UVA projections about our peak lasting into the middle of August, and the governor announced that last week. I've been looking at those projections, and as I better understand what went into that modeling, I think it's possible. There are a couple of things that did go into the UVA modeling that that may mean an earlier peak than August. For example, they look at, every model is built on a few assumptions, right? And so they look at an assumption of 20% ICU utilization, or 70% ventilator utilization, or 10 to 14-day hospital stays, none of which we're seeing right now. And so there's still details that I don't quite understand about the model, but as I talk to more people who have been looking at this, I think that we likely will see a peak a little bit earlier than originally projected. But the good news about all of this is that that peak will be significantly lower. There are a couple of other things that will change the course of how we as a community begin to come out of this. The wider availability of testing and us actually knowing where the disease is. And the hope of antibody testing, right? We've been hearing about the prospect of this for weeks. I think we're probably still a month away from widespread antibody testing, but the idea is that once that is made available, we will be able to widely test and see who actually has had exposure already and has developed protective antibodies against this. And that information will be really useful for us in terms of being able to decide when are we going to open back up as a society.